Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
When a patient comes to you with a broken or chipped tooth in an otherwise sound denture, you can remove and replace the tooth. In this case, the maxillary right central incisor needs replacement. Using a crosscut fissure burr, remove the acrylic resin that supports the lingual surface of the tooth. Expose the metal retention pins, but do not cut through the acrylic to the tissue side of the denture. Also, be careful not to remove any acrylic from the gingival margin on the labial side of the tooth. Using a spatula, gently pry the tooth free from the denture. If it is too difficult to get the tooth loose, you may heat the porcelain tooth with a Hanau torch. You may not heat an acrylic tooth or the acrylic in the denture because heating would damage the acrylic resin. After the tooth is removed, you use the vulcanite or fissure burr to remove some additional acrylic resin from the denture in order to make sufficient room for the insertion of the tooth. The new tooth will be of the same mold and shade as the previous tooth. Check the labial side to be sure the tooth fits properly into the gingival margin. Align the incisal edges. It may be necessary to grind the tooth to make it fit properly. If necessary, a small drop of pink base plate wax may be used to fasten the tooth to each of the adjacent teeth. Do not get the base plate wax into the area where the acrylic resin will be added. Wet the lingual surface of the tooth and the adjacent acrylic resin with liquid monomer. Dip the wet brush in the polymer powder and paint some of the acrylic resin onto the prepared denture and tooth area. Continue applying polymer in this way until the area is slightly overfilled. Apply a thin layer of petroleum jelly over the new acrylic resin and set the denture aside until the acrylic resin reaches the doughy stage. This will take approximately 5 minutes. When the newly applied acrylic resin has reached the doughy stage, place it in a bowl of lukewarm water for 10 to 15 minutes until it is hard. When the acrylic resin is hard, you will use the vulcanite burr to contour the acrylic resin until it blends with the denture. Then, smooth the area using a rag wheel and wet pumice. Complete the finishing with a rag wheel and Bendix. When completed, the replaced tooth is properly positioned. The repaired area has no porosities. The acrylic repair blends with the denture base and is smooth. And the labial gingival margin has not been obliterated.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.